Right, so thank you for the tallies and do get yourself seated. Here back on the local front, Delta Omicron is now the dominant strain, but authorities believe more variants are likely to emerge in the course of time. Choi Min-jung joins me now with details on that. Min-jung, welcome.
Thank you for having me.
Right, so let's begin with these concerns shared by authorities here, Min-jung.
Right. KDCA Chief Jeong Eun-kyeong warned that there is a high chance of a new COVID-19 mutation coming up somewhere down the road. Jeong referred to the so-called Deltacron, which is a variant that contains elements of both Delta and Omicron. And she said new variants like Deltacron could surface in the country at any time, given Korea's large outbreak and other regions in Europe, Brazil, and Thailand already reporting such cases. She added, although our vaccines still remain effective, it's crucial to remain vigilant and be prepared to take action in case new mutations are found.
Right, but hopefully those new mutations do not disrupt our daily lives. Min-jung, Korea's tallies with regard to severe infections and fatalities continue to fuel much anxiety, right?
Right, and health authorities say those figures could peak out sometime in the next 2 to 3 weeks, and we're expected to see somewhere between 1,300 and 1,680 patients in critical condition. Authorities predict that the figure will drop sometime in April after reaching its peak. Officials are especially concerned about the rising number of infections among the elderly and the rapid spread of stealth Omicron, which now takes up around 56% of our new cases. With this in mind, authorities are maintaining its COVID-19 threat level at its highest for the 4th consecutive week.
Right. Min-jung, what then is the government's forecast of our daily COVID-19 infections in the weeks ahead?
Right, they're expecting our daily case counts to fall under 300,000 within the next 2 weeks. And they were also optimistic that cases will drop to below 200,000 within 4 weeks. With this outlook in mind, authorities appear to be weighing the option of easing our current restrictions from next week. Under the current rules, gatherings are allowed for up to 8 people, and most businesses must close by 11 p.m. These guidelines are set to expire this coming Sunday.
Right, this coming weekend then. Meanwhile, President Moon has claimed that the worst has yet to come here in the country.
Right, and that also may be the view of health officials in regards to whether to ease social distancing measures or not, because just a few hours ago, an official mentioned there are concerns that another wave could be spurred if restrictions are lifted all at once. Now, what President Moon Jae-in said on Monday during a meeting with presidential aides is that although the government is easing social distancing measures in a gradual manner, it's a transition into measures that call for individual responsibility and voluntary participation from the public. President Moon also said that the spread of the Omicron wave is slowing down bit by bit following its peak, but said that does not mean the COVID-19 crisis itself is past its peak yet. He added that more time is needed for a clear downward trend in infections and expressed concerns over a rise in seriously or critically ill patients and deaths in the weeks ahead. While saying our vaccination rate is generally high, the president noted our stagnant booster shot campaign, calling on for more cooperation on the vaccination front.
Right, and the booster rate currently stands at 63.7%, you were saying, right? On the treatment front, Min-jung, I hear Korea has sealed a fresh deal to purchase more antiviral pills from Pfizer.
Right. Korea has secured an additional 200,000 courses of Pfizer's Paxlovid. And with that deal in place, the country has now secured enough Pfizer pills to treat 962,000 people. The country had also previously signed a deal with MSD for 242,000 courses of Lagevrio. So in total, more than 1.2 million courses will become available for use in the country. Up to this point, Paxlovid has been prescribed to 127,000 people, and Lagevrio was prescribed to 500 people over the weekend. The first prescriptions for Lagevrio was handed out on Saturday, and the drug is being given to patients who are unable to take Paxlovid for various health reasons.